Protecting yourself against a flood of Medicare healthcare costs. Hello, I am Kevin Knaus, an independent health insurance agent in California, and I assist people with finding the right Medicare plans for their situation. If we think of Original Medicare, Parts A and B, as a roof over your home to protect you from the rain of healthcare costs from a storm overhead, Original Medicare is pretty good. It's a pretty good roof. There are some holes in the roof that allow some of those healthcare costs to seep into your living room. Part A has a hospitalization deductible and co-pays for skilled nursing. Part B has a deductible for outpatient services and 20% co-insurance after that deductible is met. And of course, Original Medicare has no coverage for prescription drug medications. So without any help on the prescription drugs, it's like having a big gaping hole in your roof and the costs just pour in, just kind of flooding the basement. Now, you may not be taking any prescription medications now, but a lot of times they are in our future, so it is always good to get that Part D prescription drug coverage. And when you have that with Original Medicare, that kind of patches that hole and will give you some peace of mind that you won't be flooded with really exorbitant drug prices. Now, another way to curtail the costs of Original Medicare, those holes in the roof, is with a Medicare Supplement plan. And there are different levels of the Medicare Supplement plans, but they all cover some of the co-payments, cost sharing, and deductibles of Original Medicare. The highest level that anyone can enroll into if they're turning 65 this year is Plan G. And Plan G will pick up those Part A deductibles and co-insurance. It'll pick up the Part B outpatient, the 20% co-insurance, but you will still need to make that Part B deductible. So you'll have a little drip into the living room, but if you have a big cup, you should be able to catch it. So Original Medicare with a supplement and a Part D prescription drug plan should keep you pretty safe and dry from the rain of the healthcare cost should you experience it. Another pathway to containing costs is with the Medicare Advantage plans. And the Medicare Advantage plans, many of them have the prescription drug built into them, and it can be very good coverage, sometimes better than what you can get in a standalone Part D drug plan. Now, the Medicare Advantage plans, they do have some little leaks. Generally, there'll be some co-pays for office visits, labs, tests. Sometimes there's going to be 20% co-insurance for durable medical equipment, but there's a variety of different plans out there that cover different items, and sometimes they have a monthly premium with them. But overall, that can really cover you for a lot of different situations, and many of the Medicare Advantage plans are very reasonably priced. Now, even the smallest leak can cause a flood for some people in their finances. And there is the Medicare Savings Program that you can apply for, and that's another level of protection. And if you qualify for the Medicare Savings Program administered by Medicaid in your state or Medi-Cal in California, it's possible that they will capture all of those little drips from Original Medicare or the Medicare Advantage plan, if everything is aligned properly. So you may not have any health care costs and possibly no health insurance premiums for Part B or the Medicare Advantage plan. On the drug side, within that, is the Social Security Low Income Subsidy. Now, if you qualify for the Medicare Savings Program, you will more than likely qualify for the Social Security Low Income Subsidy to capture some of those drips from the Part D prescription drug plan. You may not qualify for the Medicare Savings Program, but you may still qualify for that Social Security Low Income Subsidy because it has higher income limits. So always apply for that to, reduce the drips from the Part D plan, those over-the-counter prescription medication costs. So those are some of the different ways we can reduce those healthcare drips and floods through the little holes in the roof of Original Medicare. And if you have any questions, you may leave comments down below. I'll do my best to answer them. You can go to my contact page and get a hold of me that way, and I will try to assist you. So for InsureMeKevin.com, I'm Kevin Knaus.